Good evening. Good evening. This is Dr. Jareka Dodd. And one of the things that I have committed to do this year is share more about how I maintain my health. You've probably seen me before talk about becoming the CEO of your health. And I think it's really important to basically be the leader, be the chief executive officer of your health. Take charge of your health. And so, in my group, which is called Empowered Health CEOs, we talk about all things health. And so, I thought, based upon my appointment yesterday, that I would share a little bit about going to the dentist because it's deeper than just your smile and your teeth. Your dental and your oral hygiene health are an indicator of your overall health. And so it's really important that you make sure to go to the dentist several times a year. I think the recommendation is that you should go at least twice a year to the dentist for your regular checkups and cleaning. However, I personally go every 3 months. So I go 4 times a year to the dentist because plaque and tartar are just no good. Maybe you have had a filling before and you know what plaque and tartar will do over the long haul. They'll cause cavities and you'll need to have fillings. And so I decided several years ago that I wasn't going to only go twice a year, but I was going to go 4 times a year. So every 3 months, because we get lots of tartar buildup. And obviously, we have to brush and we have to floss every day. I heard someone say, how do you keep, how many days do I have to floss? And the response was, well, how many of your teeth do you want to keep? So you need to floss every day, brush every day. I do things like do coconut oil to swish around because it also helps with bacteria. So I just wanted to give some perspective on why it's so important to go to the dentist, and it's deeper again than just your teeth and your smile. It's very important to go to the dentist because when we eat, we get all types of bacteria in our mouths, and sometimes we're not able to brush and floss and use mouthwash to get rid of that bacteria. And that bacteria ultimately can get into your bloodstream and lead to other health concerns and other health problems. If you have any chronic illnesses such as diabetes, it's very, very important because your body is already in an inflamed state. It's very, very important to make sure that you practice the best in oral hygiene. So not only flossing and brushing at home, but going to the dentist several times a year. So I just want to encourage you from the beginning of the year, is January, go ahead and get your preventative appointments on your calendar to go to your dentist. And as a pharmacist, I want to remind you that if you are taking any medications such as blood thinners or any medication that could potentially be impacted by you going to the dentist, it's always a good idea to check with a pharmacist, your local pharmacist, or if you have questions, you can always reach out to me either through my Facebook group, Empowered Health CEOs, or direct message to find out if there are any medications and any impact that they may have on you seeing the dentist, especially if you have any type of bleeding disorder, anything that you may be taking, or if you have to have a dental procedure done, you want to make sure that you know what medications they'll use in that procedure, as well as how your medications that you may be already taking may interact with medications that can be used in a dental procedure. So with that, I just wanted to stop in and give a few tips on keeping your smile and encourage you to get your regular preventive maintenance checkups at the dentist several times a year, 2 times a year at minimum. But again, I like to go every 3 months or 4 times a year. And then also make sure that you've got a great oral hygiene health routine at home of brushing and flossing, and making sure that you really keep your oral hygiene up, because your overall oral hygiene can impact your entire health status. So as we are learning to take control of our health and become the CEO of our health, don't forget your oral hygiene. So take care, have a wonderful evening, and be sure to check us out in the Empowered Health CEO group. We would love to have you because, like I said, we talk about all things health. So take care. Bye.